there are scientists that are working in the clinical setting or maybe the academic setting or various industries. And they may be wondering, like, what's the path to being an MSL? How do I get into the industry? What are 3 practical tips that you would give those folks watching now to transition into this role of a medical science liaison in the healthcare industry?
Yeah, that's a great question. I think there are really three things that you can do today if you are interested in becoming a medical science liaison. One, really understand the science that you do currently and be able to translate that science, which is always the harder part, into a single line, impactful statement that your mother could understand, right?
Mhm.
That was the first thing I had to learn to do. My dissertation title, I'm going to give you a little bit of it, was microRNA 125A 5P and microRNA 27B 3P and their role in fibroblast growth factor binding protein degradation via an anti-retinoic acid mechanism.
The title is a page.
I watched your eyes glaze over in the first 3 seconds, right? What does that? It doesn't help anything, right? What you have to be able to do is take that and then translate that into this statement. Mom, you know how tumors need to grow? No, they need blood vessels. My research stops those blood vessels from growing into tumors, thereby making
Beautiful.
tumors smaller.
Beautiful.
Being able to translate your science into a simple statement is step number one. Step number two, it's networking and honest networking, not networking via LinkedIn, just hey and connect, but it's really getting to know companies, therapies, and your interest in communicating the value of that company and that therapy to patients. The reason I ended up with my first role, the role that Rome and I worked closely together in, is because I believed in genomic testing, full stop. And I could communicate that I believed in genomic testing. And my background said that I had the understanding to be able to communicate that. I got that role because of a clinician that I knew from graduate school, because he knew that I was also interested in genomic testing, right? So, honest, genuine networking, sharing what you know, sharing what you're passionate about, that is reflected in every person that I've ever hired. I look for passion first, and because I can teach you the skills that you need to be an MSL. What I cannot do is give you the mindset that's required, and that passion is absolutely required. The second thing is networking. The third thing, and this is not an exhaustive list, by the way, so there may be 30 other things that I'm leaving out, but the third thing, and the thing that I think is just as equally as important as those other two, are or is being able to be resilient, because it's going to take you a while. It took me 8 months to get my first MSL role. Doing step one and step two, that will get you there and that'll keep you in the game. But it's going to take the right role to match to you and meet you. And that's going to take some resilience. But those three things, being able to communicate your science effectively, being able to network, and continuing to be resilient as your job comes to meet you, are going to serve you well, not just in getting this role, but in any other medical affairs role that you look to get.